Hello, East Texas. I'm Craig DeLisi. I'm a family physician here in Mount Pleasant. So I'm just going to answer questions that I'm that I'm seeing regularly. The first is about masking. Where we really back to that place where we need to mask, and the answer is I do think we are. And masking is honestly, in my opinion, is based on what you're seeing at the local level. So if you're seeing high numbers of cases at the local level, then that's when masking indoors is probably necessary and wise. And we're back to that point. In fact, I'm not so sure because it's hard to keep track of things like this, but if I had to guess, I would say that right now, currently in our county, we probably have more people with COVID than we have had at any point since this started. And we'll talk about the contagiousness of this particular virus in a minute, but because of that, and because of the number of cases, I do think masking is wise. Really, it's just an attempt to slow the spread. If it can cut down on how many people a given person infects, or if it can decrease your chance of catching it substantially, then it's worthwhile. And part of this is because the rate of new infections and hospitalizations have to slow down. We really need to see a decrease here. And one big concern that most of us have is with schools opening now, where kids will be in the classroom and probably there even when sometimes they have COVID, because unless they're quite sick or have fever, they're going to still attend school. In that environment, it's going to spread like a wildfire. And I expect those kids then to go home and pass it to their families. And so, when to wear masks, I don't think wearing them outside is necessary. I haven't thought that for a very, very long time. I think if you're indoors, particularly in crowded places with a lot of people, and whether or not you're vaccinated, I would encourage you to. Now, a couple of months ago, I wouldn't have said that, and that's because we weren't really seeing cases of people with the vaccine getting COVID. Delta has changed that a bit, and so because of that, when I'm in public, I do wear my mask, either my thick one or even just a surgical mask. And the point of that is not mainly because I'm afraid of catching it from you, but just in case that I might have it and have an early case, that I don't want to spread it to you. So I do think we're back there.